First, I may.
Yes, doctor.
Good evening, everybody. Today we are again gathered here for to arrange one webinar, and Dr. Saptarishi Banerjea is today's speaker. Today, Dr. Akhilesh Khan is not able to attend today's webinar as he is busy in some work. So, I welcome our speaker and I request Dr. Rashmika to introduce Dr.
Yes, doctor.
Saptarishi Banerjea.
Yes, doctor. Yes,
And then
doctor.
after, we'll start with the session.
Good evening, everyone. Thank you all for joining us today. Today we're going to talk. I am very honored in inviting Dr. Saptarishi Banerjea, our guest of speaker today. It is wonderful to have him on our platform. A little short and sweet introduction about Dr. Saptarishi Banerjea. He is the fifth generation homeopath. He is a gold medalist. In fact, he had won all the nine. He was a topper, university topper in all the 9 subjects, and he is a faculty of Bengal Island Medical Institution of Homeopathy, London School of Homeopathy, and many more. He's a ocean of knowledge, and his YouTube videos on explaining every topic at every therapeutic or every materia medica is a wonderful insight of on homeopathy. And I would love to give the mic on to Dr. Saptarishi for taking over. And with that, we will start our session today. I hope everyone sits sits in front of their seats, enjoy, learn, and apply every knowledge into your practice with the help of Dr. Saptarishi Banerjea, and that is with it. Doctor, are you ready for sharing your screen, Doctor?
Yeah,
Anything else?
No,
Yes,
that's
Doctor.
fine. Thank you. Hello and welcome everyone. I'll be sharing with you a very interesting topic about carcinosin. I have mentioned the heading to be Life and Times of Carcinosin in the 21st Century, because in today's modern day world, carcinosin is a very important remedy and has far more outreaches than when it was conceived initially by Dr. D.M. Forbister. So in this today's world of anxieties and fears and apprehensions, when the world is always on the edge, we always need to have a different perspective to understand how carcinosin can be implemented in today's world. I'll be sharing with you an interesting notes about carcinosin, which we had learned or I have picked up over generations, and I'd like to share with you how you can implement that in today's modern day practice. Look and diagnose about carcinosin is quite similar to what it has been over the generations. Cafe au lait appearance is a dusky, dark appearance of carcinosin. Quite a lot of dark moles, prominent veins. You have that with carcinosin as well. Moles are quite prominent. I'll come to the miasmatics of carcinosin later on. Carcinosin is a leading trimiasmatic. So you'll have moles which are psychotic. You can have prominent veins and the dusky dark appearance, which is important for carcinosin as a look and diagnose. Tongue is interesting for carcinosin, which also comes under look and diagnose. It's quite red. You can think of, looking at this degree of redness, you can think of belladonna, you can think of tuberculinum. It's like congestion and, like a flush and rush of blood to the particular part. But carcinosin can have this degree of redness as well, but there are quite a lot of cracks on the edges of the tongue, as you can see. So that's also an important factor for the look and diagnose aspect of carcinosin. I'll come straight to what you'll understand as what is the etiology and what is the manifestation. If you think of today's modern day world of fears and anxieties, carcinosin has a prolonged history of unhappiness, a prolonged history of fear and fright, a prolonged history of suppressed irritability, suppressed anger, and a prolonged history of anticipation and apprehension. I'll give you a few short, interesting stories to understand and apply this. If you think of a young girl, a 15, 16-year-old girl, who sees her alcoholic father come home every day and beat up her mom, and seeing that every day, day in, day out, being exposed to that, living in that constant fear and fright that my father is going to come home and violently abuse my mom, living in that anticipation every day that what if the doorbell rings and my father is going to come home and hit her. So you see the combination of etiologies coming together: fear and fright, anticipation, apprehension. Think of another 17-year-old, 18-year-old girl, and the doorbell rings and her next door Thuya neighbor comes home trying to sexually harass her, trying to sexually abuse her. And that constant, living in that constant fear and fright, that what if he's going to come? What if he's going to molest me? That fear and fright, that anticipation and apprehension. And you understand with carcinosin, it's not a single exposure to anticipation, apprehension. It has been happening for multiple times. It has been happening over a period of time. So it's not just a single time you have been exposed to it. But over time, over a year, over years, in fact. Think of a 25, 26-year-old young man working in his office who has an Axvomica boss and constantly being bullied by the boss, constantly being told off by the boss that you have to perform, you have to finish this deadline. So on one hand, there's a lot of suppressed anger that I cannot tell him anything, I cannot retort back. So that's suppressed irritability, suppressed anger. But also at the same time, living in the fear and fright, what if I lose my job? So on one hand, you have the fear and fright, and on the other hand, you have that suppressed anger, suppressed irritability. And these emotions are getting pent up over years and decades for carcinosin. Again, that's why I said it's a life and times of carcinosin in the 21st century. Think of an 18-year-old young boy whose parents are doctors or parents are lawyers, and so common with Southeast Asian children, Indian children in the Indian subcontinent. Constant parental domination. You have to perform, you have to perform, you have to be a doctor, you have to be a scientist, you have to be a lawyer. So pressure to perform. Again, living in that suppressed anger, cannot tell them anything, cannot express my disappointment, cannot express my disgust to my parents. But at the same time, living in an anticipation, apprehension that what if I'm not being able to fulfill my parents' dreams? So again, that's how carcinosin suffers in the 21st century. Think of a 40, 45-year-old woman who always has tried to maintain the family dynamics. Who has always tried to maintain the smile in the family. Although she has an Axvomica or nitric acid husband who is very abusive, who is very dictatorial. But she always tries to keep the pieces together, keep the threads together so that it doesn't break off. So constantly living in that unhappiness, constantly living with that suppressed anger, cannot express my irritability to my husband. Over years, over decades. That constant abuse. And that's very, very classical for carcinosin. If you compare carcinosin with the cancer cell, that's the doctrine of signature, you'll understand how carcinosin symptoms creep up. Think of a benign breast tumor. The breast tumor always tries to limit itself within the particular organ. So that the entire body is functioning normally and the tumor is limited within the breast cells, within the breast tissue. But when you're exposed to constant exciting causes, could be an emotional setback, could be an emotional trauma, could be a physical injury, could be drug abuse, so a constant torment with exciting causes. And gradually you'll find over time that benign breast tumor gradually turns malignant and that gradually starts to spread over the entire human body. So similarly, if you consider that carcinosin woman was always trying to maintain the family dynamics, was always trying to maintain the smile and the happiness in the family. But when you've been exposed to a prolonged history of unhappiness, a prolonged history of suppressed anger, there comes a stage for carcinosin where you burst out, where you explode. And when you are exploding, there's always death and destruction, as you find with cancer. And that happens with carcinosin as well. I'll come to what are the manifestations in a moment, but these are the foremost etiologies which are important for carcinosin. If you see this, I mentioned in the bottom, doormat woman. Carcinosin is known as a doormat carcinosin. Why? Like a doormat is always present in your front door. And everybody comes and, cleans their dirty shoes on that and walks inside. But the doormat doesn't protest, doesn't say anything back that you're making me dirty. And similarly with carcinosin, you are taking in and taking in and taking in all the emotional traumas. You're not exploding. But there will come a time, unlike the doormat, where carcinosin will explode, where carcinosin will give it back to you. And that's very, very important to understand how carcinosin's emotional picture sets up. If you compare these etiologies with any other remedies, if you think of fear and fright, you have that with aconite, you have that with opium, you have that with hyoscyamus, you have that with gelsemium, you have that with stramonium. But with all of those remedies, it's generally a single event where you have been exposed to the fear and fright. Whereas you understand, as I shared with you the story of that young girl who has a neighbor who is trying to molest her, it's a prolonged exposure to that fear and fright. Of that young girl who has been exposed to a violent alcoholic father, it's a prolonged exposure to fear and fright. Unlike those remedies where it's a single event, where you had a fright, where you were exposed to fear and your symptoms started. But you have to understand with carcinosin is a series of events rather than a single event, which is precipitating the onset of symptoms. Now, when you try and understand and analyze the personality of carcinosin, especially in today's 21st century, you have to understand carcinosin is very similar to phosphorus. Sentimental, sympathetic, like soft music, romance, soft light, soft hearted, very sensitive to music, rhythm, thunderstorm. They always want that rhythm in their life. Close to phosphorus, close to sepia. They're sensitized by thunderstorm, sensitized by rhythm, music. They're organized, they're perfectionist. One of your top fastidious remedies. So carcinosin has that innate nature of being a perfectionist, of being very fastidious, sympathetic like phosphorus, romantic, soft-hearted, like soft music, like phosphorus, fastidious like phosphorus, likes rhythm, likes thunderstorm, like sepia. Sepia can have fear of thunderstorm. Sepia is also sensitized by thunderstorm. They enjoy that thunderstorm as well in sepia. That's why phosphorus followed by carcinosin is always a good chain in very many chronic conditions. Again, the innate nature of carcinosin, as I shared with you, romantic, sensitive, sentimental. But again, when you have been exposed to those exciting causes over a period of time, your nature is bound to change. And here comes the importance of understanding the miasm. Carcinosin can have manifestations in all the miasmatic planes. After a history of series of disappointments, history of series of unhappiness, you can have a sodic carcinosin where there is empty feeling. I feel hollow inside. After this degree of prolonged suppressed anger, prolonged anticipation, apprehension, I feel a hollowness inside me, emptiness, lack, hypo, sora. You can have a psychotic carcinosin where initially you'd find them to be very perfectionist, very fastidious, but as pathology deepens, as the pathology progresses, that perfectionist nature, that fastidious nature gradually borders onto being obsessive natures. So you'll find a series of obsessive compulsive disorders coming on in carcinosin, checking and rechecking, washing, cleaning. Some like a maniacal condition sets on in carcinosin. So when in health, they were very fastidious, very artistic, very creative. And that has gradually changed, that has gradually blurred into obsession where they're checking and rechecking, where they're being overtly obsessive, which is again a psychotic carcinosin. You can also have a syphilitic carcinosin when you have been exposed to these prolonged exciting causes. Over time, you become destructive. You break things, you become aggressive, you're throwing things, you're hurting people physically, you're becoming violent. And that destructiveness is one of the very important criteria of carcinosin as well. If you compare that with the cancer cell, always trying to stay within that organ, trying to make the body function in a healthy state. But now, when it has gone to spread to the different organs, there is death and destruction. Similarly, with the carcinosin nature, personality, when you've been exposed to that prolonged exciting causes, you can have a syphilitic carcinosin where they are totally destructive. And lastly, you can have a tubercular carcinosin as well, where they become very stubborn, where they become very obstinate, where they develop tremendous mood swings. Symptoms like what you find with bipolar, schizophrenia, and that's a tubercular carcinosin as well, where you have the changeability, where you have the obstinacy, and that's very classical for a tubercular carcinosin. So that's why in today's modern day world, in today's modern day emotionally challenging world, you'll need carcinosin because you have lots of personalities who have been exposed to that prolonged anticipation, apprehension. You know, today's cutthroat competition, especially with a rat race for jobs, you'll find that constant pressure to perform. With those bossy dictatorial bosses, You're having that suppressed irritability. Cutthroat competition for becoming a doctor, for becoming an engineer, for becoming a lawyer, constant pressure to perform, suppressed anger towards parents, living in that anticipation, apprehension. What if I cannot? What if I cannot? And lastly, do also remember for carcinosin that with the modern day world, you're constantly living in a state of unhappiness many times over years, over decades, and that triggers on the onset of carcinosin symptoms. If you see here, I've mentioned they're soft, sentimental, sympathetic, family oriented, dutiful. You give them something to do, carcinosin will go out of their way to do it, to finish it. But when you push carcinosin to the limits, they become stubborn, they become destructive, they become rebellious, they're protesting now against it. Just like the cancer cell. When you cannot take in, it metastasizes, it spreads through all the organs, promoting destruction. So that's why you have a carcinosin in all the four spheres of miasms. If you see here, the nature of carcinosin, soft, sympathetic, sentimental, but again exposed to unhappiness, exposed to fright, they become disobedient, they become destructive. They do not like authority anymore. And here you have to understand that they have taken that authority for years and years and years. They had an axomica husband, a dictatorial, a lycopodium husband who loves to control for years. They've taken in over years. But now they cannot anymore. They're protesting. They're fighting against it. They become really, really stubborn and obstinate with carcinosin. So you have to understand carcinosin's nature and how the onset of these etiologies over a period of time results in the aberrations, results in the onset of these kind of symptoms over time. You have to understand the difference with closely related remedies. If you think of a close remedy, which is phosphorus, which has a soft, sympathetic, sentimental nature, the artistic and creative. But again, with phosphorus, you won't find that syphilitic nature of becoming destructive, of becoming stubborn and obstinate, which is tubercular. So that again is lacking in phosphorus. If you think of a closely related remedy, which is Stevia, again, where you can be exposed to prolonged grief, suppressed emotions, reserved displeasures. But again, here comes the importance of miasm. Stevia is in its innate nature psychotic. But as I shared with you, carcinosin covers all the miasms in equal degree. Stevia is also taking in the emotions, also bottling it up, keeping it inside, trying to maintain the dignity. But whenever Stevia protests or Stevia expresses the anger, either you can find a Stevia trembling with anger, they're shouting, or they're trying to say what they want to, and they're trembling with anger, or you can find a Stevia throwing away the things when they are angry. So that's the highest degree of expression of Stevia. Either they can tremble with anger and insults, or they can throw the things. So that's again the limit of a psychotic Stevia. You have to understand Stevia is limited by its psychosis nature. That's the boundaries. But with carcinosin, there is syphilis, there is tubercular. That's why you can find a stubborn carcinosin, you can find an obstinate carcinosin who is disapproving authority, or you can find a destructive carcinosin who is becoming aggressive, and doing violent things, which is one of the basic differences with cervix agraria in the modern day world. What is common? Both remedies have a history of suppressed anger. Both remedies have a history of prolonged unhappiness, reserved, suppressed emotions. Both have been bottling it up for years, keeping it inside. Both are very mild in nature. You'll find in cervix agraria, as in carcinosin, there's always a sweetness, mildness inside, softness inside. But whenever your cervix agraria explodes, is either through trembling, the voice trembles, their body trembles with anger, or they're throwing things when they're angry. But with carcinosin, as I shared with you, you can have the variety of manifestations in carcinosin. You can have a syphilitic, you can have a tubercular carcinosin as well, where they are breaking things, where they're being stubborn and obstinate, which is very important to analyze. Unhappy childhood. This is very important, especially when you're analyzing a chronic case. We always ask the patient to narrate their life story. And you'll find carcinosin, whenever they're narrating the life story, that when you look back at your childhood, was it a happy childhood or was it a traumatic childhood? Carcinosin will always look back at being a traumatic childhood. Seeing on the top left picture, seeing her violent alcoholic father come home and beat her mother, living in that fear and fright, living in that anticipation and apprehension. She's taking a bath on the top right picture, taking a bath. And her next door, her Siamese neighbor is coming and knocking at the door, living in that fear and fright. What if he molests me? Living in that prolonged unhappiness, living in that prolonged anticipation and apprehension. That what if I'm going to be molested again? So that unhappy childhood always triggers the onset of symptoms for carcinosin in the modern day world. If you try and understand also, as I shared with you, the pressure to perform, that's also an important factor as you understand in today's modern day world, the competition which you face as a student, a competition you face when you're going out in the real world for doing a job, for getting a job. And there's always that pressure to perform. A remedy which comes very close to carcinosin is anacardium. Anacardium also has got a similar etiology of being of pressure to perform. And you have to again understand the comparative medica here. Because in case of anacardium, whenever there is a constant pressure to perform, it's always like two wills in anacardium. You understand, Master Kent mentions that in the medica, angel sits on one shoulder, the devil sits on the other shoulder. Obviously, in the modern day world, you do not find the patient telling you that each day in your practice. But what your anacardiums will tell you is, I have this urge to succeed on one hand, the desire to succeed on one hand. But in anacardium, there's also the cowardice, the coward feeling that what if I fail? So on one hand, there is an urge to perform, there is an urge to succeed. But on the other hand, there is a low self-confidence. That what if I cannot do it? Cowardice. And there's a constant tug of war going between the good, which is the urge to succeed, and the bad, the low self-confidence. And whenever it's time for a deadline, whenever it's time for an examination in anacardium, it's time for short time, to be very precise. Anacardium is not up to the mark. There's a sudden loss of memory. There's a blackout. I cannot do it. Deadline, I cannot perform. Examination, I cannot do it because I'm breaking down under stress. And when that pressure to perform has been going on for months and years and decades in anacardium, and they have been experiencing failures at every step in their life, you'll find anacardium gradually becoming abusive. But again, not to that destructiveness of carcinosin, but you'll find they're being more verbally abusive. You'll find anacardium cursing and swearing, which is the extent of their violence. Again, because anacardium is not syphilitic, it's more sodic and psychotic. So try to understand in carcinosin, the pressure to perform can result in obsessions, can result in being disobedient and stubborn, or can result in being destructive. But with anacardium, the devil being the low self-confidence, the angel being the urge to succeed, you're constantly stuck in the tug of war. And at one point of time, when it's the show time, you break down. You break down repeatedly because you have a sudden loss of memory. And that goes on for months and years. You become frustrated, you become depressed, and you start to curse and swear. And that's how, remember, with a history of pressure to perform, again, the times of 21st century, you'll find anacardium well indicated, you'll find carcinosin well indicated as well. So with the unhappiness, with the suppressed anger, do understand cephalocycline carcinosin is a very good chain. But with a history of traumatic childhood in terms of pressure to perform, do understand anacardium followed by carcinosin is also a very good chain. So both these remedies will come in very handy whenever you are being stuck in those conditions. Changeability is an important factor. As I shared with you, this is more like a tubercular carcinosin where there is changeability. In the morning there, she's doing vandalism. She's breaking the glass panes, windshield. And in the evening, she's enjoying a nice candlelight dinner. So that changeability you'll find with carcinosin. Again, when you have been exposed to those exciting causes. If you think of the comparative medica of changeability, you understand, I'm sure pulsatilla is changeable. But again, pulsatilla's changeability is crying and laughing, joy and sorrow. And within a very short span of time, pulsatilla can be changeable. Very common with her periods, during her menses. Again, that innate nature of pulsatilla is always very important. Clark compares pulsatilla to the race of sheep, mild and timid. If you think of Ignatius' changeability, it's like a hysterical changeability. You're going from ha 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 ha, so from laughing to crying, from shouting and wailing, you're going to being quiet. So it's a hysterical changeability with Ignatia. Again, in response to a grief, in response to a fright, in response to a disappointment in Ignatia. If you think of Medorrhinum's changeability, Medorrhinum, though, is a psychotic medicine, but you have the changeability in Medorrhinum as well. You also have to remember for Medorrhinum, it's an extreme in excess. Either you are from this end of the spectrum or to that end of the spectrum in Medorrhinum. First semester, wonderful grades. Second semester, failed in all the subjects. So either you're brilliant or you're dull. The mother will wonder, my child is so introverted, is not interacting with anyone for a few months. Totally gone into a shell. You feel like it's an attromute. A few months later, he's partying all over the town, meeting everyone, making new friends like a phosphorus. So that changeability, it's like a pendulum which is swinging from one end of the spectrum to the other. And that's Medorrhinum's changeability. It's changeable, but it's never in between in Medorrhinum. It's always either this nature or that total extreme and opposite personalities in one constitution. And that's Medorrhinum's changeability. If you think of tuberculinum's changeability, yes, tuberculinum is changeable as well. But how and why? In case of tuberculinum, you have to understand that this changeability is arising out of dissatisfaction. With any tubercular remedy, you'll find at its basic core criteria, there is dissatisfaction. They're dissatisfied easily. They're bored easily. and they're being bored, they're being dissatisfied, is one of the greatest impetus, is one of the greatest stimulus for their desire to change. I'm so bored, I'm so dissatisfied with my life. I'm changing everything. I need change. I need to travel to satisfy that, to quench that thirst for change. So tuberculinum is also changeable. But again, as I shared with you, this changeability is more arising out of dissatisfaction, which is quite important for tuberculinum. They're very bored. And how do they satisfy the changeability? Through only traveling. They love to travel, and that's how they are able to quench that thirst for changeability. But you have to understand, with carcinosin's changeability, with carcinosin's bipolar nature, is always that impact of the etiologies in the background. Either there is a fear and fright, anticipation, unhappiness. There's always those triggering factors which come to the forefront with carcinosin's changeability. Obviously, you'll have other remedies which are also changeable. You have that with platina, you have that with nux moscata. But again, you have to understand those are generally, there is changeable moods in those remedies as well. But these are your top polycress which have the changeability. And it's important to understand comparison with the changeability, especially the three nosodes, medrhinum, tuberculinum, carcinosin, are all important remedies for that changeable behavior, for that mood changes. But you understand, with carcinosin, the changeability is arising out of the triggering factors of etiology. With medrhinum, is a nature of change, but again, you have to analyze extreme in excess, either one end of the spectrum to the other. And in case of tuberculinum, there's always that boredom, there is always that dissatisfaction, which is triggering the onset of changeability in tuberculinum. So that's also an important factor for understanding carcinosin. Rhythmic, I shared with you, they love rhythm, they like romance, or like enjoying a candlelight dinner. That's that basic nature which you'll find with carcinosin, which is important to understand. So that's about the emotional essence of carcinosin, which is quite useful to understand. Do also remember, carcinosin has got very useful and creative hobbies. They like traveling, they like music, they like creative hobbies like gardening, like painting, like floral arrangement. So artistic and creative hobbies is always nurtured by a carcinosin patient, or a carcinosin personality, to be honest with you. I've also learned this as an ancestral tip over generations, that with carcinosin, with the prolonged history of unhappiness, with the prolonged history of anticipation, there's always that unfulfilled feeling inside. As I shared with you, like a sodic carcinosin will tell you, there's that emptiness, there is an hollowness inside me. There's also the unfulfillment, that I have not been able to fulfill what I wanted to do in life. And that's a very important factor. When you encounter a 40s or 50s carcinosin, look back at their life and will tell you that I haven't been able to do justice to my abilities, I haven't been able to do justice to my capabilities, and I feel unfulfilled inside me. And that's also a very, very important word to understand carcinosin. My friends, it's always important to understand what the patient says in their own language, because that's always the best way to understand remedies. And in that way, carcinosin is always very useful to read, to analyze as well. So that's about the emotional component of carcinosin. I will take you to the physical issues. I will just take another PowerPoint, and I'll just give me a moment. As I shared with you, carcinosin can be prescribed just on the emotionals, as I shared with you, the times in the 21st century, but you'll also find carcinosin to be prescribed with good results with physical symptoms as well. Interesting case of alopecia, which I like to share with you. A young girl, 21 years old, who came to me with alopecia. This was the initial state at the start of treatment. Find quite a lot of hair loss. Her major symptoms were alopecia since past 4 years, which was the major reason why she was consulting. Other than that, she had a few gastric issues, which were not that chronic. You understand that's been for a month, sour mouth, heartburn, reflux symptoms, worse from fasting, better from eating. She mentioned debility was quite prominent and the scalp was oily. Oily skin, if you think of, or oily face, you have that a few remedies for that. You have that in natmure, you have that with selenium, you have that with thuya, you have that with plumber. Oily face. So that's more psychotic remedies. I repeat, natmure, selenium, thuya, plumbum, all those have oily skin. Oily scalp, those remedies can fulfill. Mercury, bryonia also are remedies for oily scalp as well, which she mentioned. Her face wasn't that oily, but the scalp was really oily and shiny, as you can see here as well. So that was one of the predominating factors. Obviously, with any case like this, we always try and dig deep into the etiology, how the complaint started. Interestingly, she had a recurrent fever, high fever every year in August. It was generally a slow rise of temperature. Fever used to stay for a week, then used to subside without medication. So she has been having that fever for quite a long time. And in one such year, when she had the fever in August, alopecia precipitated or started gradually after that. And unfortunately, she hadn't got any blood tests done in any years for the fever. So it was an undiagnosed fever or a pyrexia of unknown origin. So she had this high fever every year for quite a few years. And in one such year, which was 4 years back, it triggered the onset of the alopecia. The past history, as I mentioned, recurrent high fever in August every year, slow rise of temperature, fever used to stay a week. She also had a history of bleeding hemorrhoids, which was treated with homeopathic remedies. A family history of cancer was quite prominent in this case as well. Particulars: bad breath, gum bleeding, profuse leucorial discharge, which was causing more weakness. So one of the reasons for the debility was a lot of leucorial discharge. Generals, stool was every alternate day, hard, sometimes mucus. Urine also had offensiveness. So offensiveness was quite prominent. Bad breath, offensive urine as well. Sweat was quite offensive as well. Irregular periods, black clotted blood. Hot person who used to like sour and sweet. Egg was quite prominent. Thirst was average. I didn't get much emotionals. She father died due to cancer, and there was a lot of disappointment due to that. Loss of father's love. She was quite tidy, weepy because also of her present condition. She was quite depressed. And fear of snakes and reptiles wasn't that prominent. She's coming from a semi-rural area, which in Bengal, which was quite snake infested. I'm sharing this case. Also, one of the important factors is I started wrongly, to be honest with you. And sometimes it's important to learn from your failures rather than your successes. And here I like to share with you how I started off and I failed, and which is important to understand. September 20, I started with fluoric acid. Considering alopecia, which was quite extensive syphilitic, She had quite a lot of offensiveness. So syphilitic symptoms, bad breath, stool was offensive as well, urine was offensive. So quite a lot of syphilitic symptoms were there in the case. And you understand fluoric acid is a hot syphilitic. If you look in any Metromedica, you'll see it's mentioned about alopecia with a lot of offensiveness in a hot patient. Fluoric acid, hot syphilitic. I started with 200C. No change when she visited. I generally follow up in 3 to 4 weeks time. And in 4 weeks time, there was no change with alopecia. Acidity was better, but you understand that was more an acute issue. But there was no change at all with alopecia. I went higher up, went to fluoric acid 1M. Again, no change. She came back a month and a half later, 25th of November. Now, what was interesting that she told me that she hadn't gotten blood tests done in the previous years, but in 2020, she got the fever again in August, and then she had done the blood test, which showed Vidal positive, and she was diagnosed with typhoid fever. So I interpreted that in the past few years, there was a slow rise of temperature, could be typhoid, and the fever used to last for a week or so, which was coming back recurrently, although she hadn't got any blood tests done. So based on the reports of 2020, I prescribed typhoidinum 200 followed by 1M, considering the etiology that probably the typhoid fever could have precipitated the onset of the alopecia. So I prescribed a Nozode and 2 succeeding potencies. This has been mentioned by D.M. Forbister in his book Tutorials on Homeopathy. When you're prescribing on etiology, prescribe 2 succeeding potencies in a span of 2 weeks' time. 200C, 2 to 3 weeks later, another 1M. But again, she came back after 2 months in February. There was no change with alopecia as well. Thank God she came back for treatment. Even after 2 follow-ups, there was no change. I retook the case again. 2 factors here you have to understand. There was obviously a strong family history of cancer with the father, with the grandfather, colon, and prostate cancer. But one of the important factors for carcinosin also you have to understand, there's a series of inflammatory illnesses which precipitates the onset of symptoms, which is important to understand. It can be a series of pneumonias, it can be a series of fevers, it can be a series of flus or whooping coughs. So a series of inflammatory illnesses in the past, which has been there for months and months and months, which triggers the onset of symptoms. So obviously, as I shared with you, you can prescribe carcinosin based on the emotionals, but also you can prescribe carcinosin based on the physicals as well, where obviously a past history of cancer was important, but here was also important the history of recurrent fever coming back every year. And you understand a fever being an inflammatory condition, which was recurrently happening every year, which triggers the onset of symptoms. Either you can have a past history of inflammatory illnesses, or you can have a family history of inflammatory illnesses in carcinosin. So a recurrent history of pneumonia, a recurrent history of bronchitis, a recurrent history of whooping cough, or a recurrent history of fever. An inflammatory illness which is triggering the onset of symptoms. And that's very important to understand carcinosin as well. Do remember, carcinosin can have a strong craving for eggs. They can have either a desire for eggs or an aversion to eggs. It can be either ends of the spectrum in carcinosin. So desire for egg was also an important factor for picking up carcinosin as well in the symptom picture. Again, you see carcinosin 200C followed by 1M was prescribed again based on the etiology. Etiology of recurrent fever, etiology of recurrent inflammatory illnesses, which could have triggered the onset of alopecia. Thankfully, she kept faith with homeopathy and she came back. March, it was slightly better. April was standstill, and she also had amenorrhea since December. She hadn't menstruated for 4 months. I repeated a carcinosin 1M, single dose. In June, she came back again, where her alopecia had improved quite a lot. And she had her periods as well with the last course of medication. So which was also a good sign for the remedy to be working well. And she's still under my treatment, obviously, because it's early, but you see hair has started to come quite well on the front, and there's still room for improvement on the back as well. And we're trying as much as we can to bring back the hair. And she was quite happy because she didn't need to wear the wig when she came for the consultation, because hair had started to grow back quite well with Carcinosin as well. And here you see one important thing is to understand how I failed. I failed because I ignored the history. I ignored the past and the family history. I prescribed on the initially on few symptoms, which I failed. I failed again when I picked up the wrong etiology, picking up typhoid as an etiology. But hopefully I have been able to do justice with Carcinosin because it is helping to take care of the past and the family history as well with Carcinosin. So that's a very important factor to understand for Carcinosin. Few factors I like to share with you, again, keeping in mind today's world for Carcinosin. You'll find a lot of people coming to you with a history of recurrent inflammatory illnesses and triggering the onset of symptoms with a family history of cancer. Do remember Carcinosin. Carcinosin also can have a strong family history of diabetes mellitus. So that's also important to understand when you're prescribing Carcinosin as well. Cancer and diabetes mellitus are very strong in the family when you're thinking of prescribing Carcinosin. Few clinical tips I'd like to share with you before closing on Carcinosin. Sleep is interesting. Remember, Carcinosin has got prolonged insomnia, but they're never ever tired, although they're not being able to sleep. They sleep for 2 hours, they sleep for 3 hours, but still they are unable, they are not at all tired. You'll find Nazomica, you'll find Macab being totally exhausted, drained out after loss of sleep. Cocculus being totally drained out if they're not having good sleep. But with Carcinosin, I can sleep 2 hours, but I'm absolutely fit and fine and fresh the next morning. So insomnia without suffering is a very good clinical tip for Carcinosin. Do also remember for Carcinosin, they sleep well in the knee elbow position. Like Medorinum, like Calcadia fos, they sleep well in the knee elbow position, genupectoral position. That's a good sleep position. Like Cinna, that's quite important for prescribing Carcinosin as well. Seaside, do remember Carcinosin can have a biphasic reaction. You can have either a polarity, amelioration from seaside, or an aggravation from seaside. So both sides of the spectrum, both sides of the coin you can find with Carcinosin as well. So those are few of the important factors for trying to understand and prescribe Carcinosin in the 21st century. Thank you very much for your kind attention. If you have any questions, I'll take them up now, please.
Yes, thank you so much for a wonderful presentation, Doctor. It was really informative, and we were all learning a lot and understanding the pathology of carcinosin, the mentals of carcinosin. We have a few questions. Can I, is it okay? Shall I read it out to you?
Yep.
Yeah. Dr. Shubhamay Ghosh has said it was a wonderful presentation, and he's also asked to explain the PTSD after COVID-19. If you would be able to give them a few, explain the medicines in PTSD of COVID-19, where stresses are predominantly present for long days. These clinical conditions are frequently found nowadays. Yes.
I've prescribed Carcinosin as well, in today's world with COVID, where there's again a prolonged uncertainty, anticipation, apprehension, where you have to understand Carcinosin comes in handy because of the prolonged history of anticipation, apprehension. And there is that constant pressure to perform because you're constantly losing your jobs. So Carcinosin comes in handy in those conditions where there is that pressure to perform, where is that constant anticipation, apprehension of losing their job. I have prescribed again with very good results Califos in potencies 200C, 1M and 10M, where there is a constant anxiety and worry resulting in insomnia, resulting in loss of memory, loss of comprehension, especially in the COVID-induced world. Calcarea group of remedies also comes in handy. Calcarea carb, especially when there's an insecurity, what's going to happen in the future. And that is a very common word detailed by patients with PTSD in today's world, where they're telling you, I cannot look into the future. There's always a darkness at the end of the tunnel. So Calcarea group of remedies will always come in handy with the insecurity, with the anxiety, and alertness, apprehension. So those are few remedies which always comes in handy. As I shared with you, anacardium as well, where people are becoming aggressive nowadays, abusive, cursing and swearing with the pressure to perform. Nitric acid I've had with good results, where you understand with nitric acid somebody is taking care of a COVID patient, waking up at night, there's a constant stress and anxiety. Along with that, there is night watching. They gradually become irritable, they're gradually becoming argumentative. And nitric acid is also a very useful remedy to help in those conditions as well.
Okay. Another question. Rajur has asked, fastidious. Can you differentiate differentiation of fastidiousness in every materia medical diabetes?
There's quite a lot of remedies, to be honest with you, for fastidiousness. But as I shared with you, carcinosin's fastidiousness is more like an artistic fastidiousness, which you'll find with us with phosphorus as well. It's more artistic and creative fastidiousness, making floral arrangements, making everything very artistic and creative. But again, when carcinosin has been exposed to exciting causes, that fastidiousness now goes on to obsession, which is interesting for carcinosin. If you think of arsenic's fastidiousness, it's more like a anxiety fastidiousness. It's more like fear of infection fastidiousness, where I'm trying to make everything, my environment, infection free, trying to make everything very, very clean. So that kind of fastidiousness you'll find with arsenic, where it's more like an anxious fastidiousness. If you think of Nux vomica's fastidiousness, Nux vomica is also fastidious, but it's always about the workplace. Always try to make the workplace very neat and clean, very tidy, so that they're always on the top of their game. We go to the Nux vomica's homes, it can be untidy, but the workplace where they're spending most of their times being a workaholic, that's always very neat and clean and tidy. So that's important to understand how you differentiate the fastidious remedies.
We also have a Facebook Live going on I Love Homeopathy Facebook page, and there have been a lot of comments over there as well, and everyone has thanked you for your valuable time and presentation. They've appreciated your presentation. There are a few questions. Do you take patients from the US?
Yeah,
If
yeah.
so,
You can email me. I can give you the details. Thank you.
yeah, and they've asked you if you could show or guide us with a repertory for carcinosin.
To be honest with you, I hardly use my repertory. I understand my remedies from the Metromedica point of view. So whenever I'm prescribing remedies, it's from Metromedica. And as I shared with you, my strongest area of understanding is comparative Metromedica. So repertory is not my forte, and all I shared with you is from my understanding of Metromedica and comparative Metromedica.
Dr. Arjit Pal Chaudhary has asked, what is your opinion on prescribing carcinosin in a case of cancer, whatever may be its kind?
It's again, we do not prescribe arbitrarily in cancer. I have prescribed in cancer for carcinosin, but again, based on either emotional symptoms or a strong history of like inflammatory illnesses or a history of cancer in the family. But obviously in low potencies, 30C, and perhaps LM scale as well. But obviously it's not like an arbitrary prescription of carcinosin in every case of cancer.
Yeah. Dr. Deepali Kansal has asked, a nitric acid patient gets irritable after night watching and looking after poorly family member. Any remedy when patient is depressed or pessimist after seeing a lot of family members suffering?
Yes, Dipali, you can always think of causticum for that. You understand with causticum, there is a line in Allen's prolonged history of grief and mental suffering, as well as you have night watching as an etiology in causticum, resulting in pessimism, resulting in hopelessness, resulting in depression, which is important.
Last question. Radha Vedak has asked role in COVID. In the sense, is carcinosin's role in COVID or
As I
in
mentioned,
general?
yeah, as I mentioned, Radha, that carcinosin can be useful in post-COVID or long COVID, where you are suffering from the emotional setbacks with losing a job, living in that prolonged fear and fright, constantly living with unhappiness. So it can come in handy, but you have to understand the time frame is very limited to be able to prescribe carcinosin post um, COVID. You'll see as the years are progressing and carcinosin symptom picture will gradually come up post COVID. But it's too early to prescribe carcinosin because it's been just a year and a half, and you won't find that degree of carcinosin symptom setting up so early, to be honest with you.
Sorry, doctor. A few more questions in the Facebook. Which materia medica do you use is one of the questions. And yeah.
NM Chaudhary's Metromedica, Nash, Kent, and Tyler's Drug Pictures. Those are a few of the best books which I like to suggest, and um, I'll suggest you read those.
Yeah. And last question, doctor. Any remedy to remove spike protein? Is
We do
one
not
question.
prescribe on clinical conditions, to be honest with you. You have to have the symptom picture to combine that with the clinical conditions. It's difficult to say that.
With that, is it okay with ending the Q&A session over here? Is there any other questions? Please text in the chat box. Okay. Wonderful presentation, doctor. Thank you so much for taking your time and giving a wonderful presentation. And special mention that not many doctors would come forward and be able to talk about the first failure in the first prescription. And I think that is something which everybody needs to know and everybody needs to understand. As doctors, it is learning. It is the process of learning that makes us a better doctor. And it was wonderful for you to share the entire case with us, and it is always an honor. And with that, I would request Dr. Prashant Barber to give a ending speech, vote of thanks. Dr. Prashant Barber. Okay, 1 second, doctor. I just noticed it. Yes, you can unmute yourself, doctor. I'm so sorry. I just noticed that you weren't able to mute yourself. Unmute yourself. Yes, doctor.
Dr. Banerjea, sir, you have given a good lecture on the materia medica on the subject of carcinosin. Really, it is a fantastic one for all the students. Majority of students are there from my college that they are attending this webinar, and really it is fish for them that they are able to understand the remedies in a new way. And really it is a evidence-based practice, or whatsoever the lecture you have given, that is evidence-based. The clinical cases you have present, that is a good thing for beginners. Those are the beginners from first year to final year students are joined here for to attend this webinar. And even some practitioners or teachers are also there from my college, so it is good for them. And I really appreciate your presentation. And I also hope that in the coming days, uh, we will invite you for a new webinars or on a new subject. Thank you very much. And all the uh, students and those who have attended this webinar, I am thankful from our institute that you have joined this webinar. And again, the Bohla Foundation, those who have given a chance for Antar Bharati Homeopathic Medical College to arrange to give us a dais to present this webinars. So thank you very much, sir. Thank you, Rashmika, for hosting this webinar.
Thank you
Okay.
so much, doctor.
Thank you, everybody.
Thank you so much, doctor. Thank you so much. Have a good evening. Have a wonderful day ahead. Thank you. Sir, with this, shall I end the meeting, doctor? Yeah?
Yeah, thank you.
Yes,
Okay.
yes.
Thank you so much. Have a nice day ahead. Thank you. Thank you.